Hello, you're most welcome to Dr. SGM Brain and Spine channel. I'm Dr. Joseph Mary Ssembatya. I'm a neurosurgery clinical fellow in Uganda. My mission is really to make brain and spine disorders easier to understand to parents, to any health worker, and even someone who's enthusiastic of knowing about brain and spine. So, in this case series, and the first episode, we are going to talk about spina bifida. And in that, we shall know what is spina bifida, how does it prevent, how does it present, how can we prevent it, can we stop it, how do our patients or children get spina bifida, or what we call those swellings in the back. So in this first episode, we shall describe what spina bifida is. Basically, commonly these patients present with the swellings in the back. Some may not really present with swelling, some may just present with some stigmata or some bit of hair or a dimple in the back. However, this is a part of the continuum of a wide birth defect called tube defect that is mainly caused by a defect in the neural arch, generally in the lumbosacral region. So what happens that during embryology, once our spine and spinal cord are developing, mainly around the 25th to 28th week, there is a defect in one of the arches of the vertebrae, the bones of the spine. Yeah, mainly the lower bones around the lumbar sacral region there. The one of the laminar arch is not formed, and this leads to the spinal cord or its covering, the meninges, to come out of that through that defect. So generally, that is the spina bifida, and really this occurs early during pregnancy, and even sometimes the mother is not aware that she's pregnant. As we know, in this part of the world, Uganda and some parts of Africa, many women get pregnant when they are not even aware that they are pregnant. They realize when they are 2 months, 3 months, when they have missed their periods, and that's when now they start thinking of taking drugs, start thinking of going to the hospitals. However, the part that forms the brain and the spinal cord, that's the neural tube, has already been formed around the 25th to 28th day of gestation. So now this calls for us to know about this condition called spina bifida, because we have seen quite a number of parents that come with their children and they're a bit worried, they don't know what caused this. They have so many unanswered questions, really. So in this series, we shall be answering part of these questions as we move forward. So that's how really spinal bifida is formed. As we have said, it's a swelling. Most cases present as a swelling in the back, and that's the most worrying one that mainly forces mothers to come with their babies. It can be the types of spina bifida. It can be either occulta, whereby you just have like a dimple at the back of the of the spinal cord, just in the back. You have like a dimple or sometimes a tuft of hair. Yeah, so that is mainly occulta. So in this, the spinal cord is not visualized out, and the meninges or the coverings of the spinal cord are not visualized out. However, you can have other types like the stickers. You can have myelomeningocele, whereby these ones they protrude out of the defect. The spinal cord comes out with its coverings. Those are the meninges. Or you can have a myocele, whereby it's just a flat wound on the back of these babies. Or you can have a meningocele, whereby there are no, the spinal cord is not there, or its nerves are not there, but the coverings of the spinal cord. And the coverings, basically, in simple terms, there are three. And that's the dura, the hard one, and then the soft ones. That's the lacunar and the pia. Yeah, so they tend to come out with or without the neural tissue itself. So this, in this case series, it is important for us to understand that these conditions can happen. However, they are treatable and preventable. So why this case series? Why spina bifida? Why are we talking about it? So it's important to talk about spina bifida mainly in this era uh, where we have solutions to these problems as neurosurgeons. It's one of the most common congenital abnormalities of the nervous system, of the brain and spine, and it affects really very small babies. Just it is diagnosed either before birth or during birth, but most of the mothers realize when they're delivering these babies that, oh, my baby has a swelling in the back. So uh, they are very common congenital abnormalities that happen at birth. And if they are not catered for well, the effects can last for a lifetime. Yeah, and it matters for us to know really about this because it can lead to lifelong disability of the babies if not treated. However, not every child is affected the same way. So some children really can have a very fantastic life uh, after that if it is diagnosed and treated early. However much it affects the back, it can affect multiple body systems uh, because this, once it is so much down, it can lead to bowel problems. The baby may not be able to, over time, to control their urine, stool, uh, quite a lot of things. They can have bone problems, whereby we need orthopedic people to come into play. And it's mainly really a multidisciplinary team. They can have cranial problems, like brain problems, however much the problem is in the spine, down in the back. But these are babies that can come up with big heads at that side of cephalus. Yeah, so this is a call for early diagnosis and then early intervention, mainly surgery. And we know that mainly for those babies that are born in rural areas, they face challenges and delays to reach the hospital so early. So this is a call for all patients, for all mothers, all parents that have these babies, that once they are diagnosed early, they can receive treatment. And with multidisciplinary approach, their lives can be made better. Lastly, this disease is important for us to talk about it because it affects the entire family. Parents spend multiple days, nights, months in and out of hospital looking for treatment. It affects finances at the household level, psychological torture, a lot of stress. So you ask yourself, why my baby? So that's why it is important for us to talk about this. However, once these children are diagnosed early and they receive treatment early, they can have a meaningful life at the end of the day. So, what's the take home message really in this short video? Is that a child born with spina bifida deserves compassion, deserves timely medical care, and such a child deserves opportunity to reach their full potential in life. So, keep watching this channel. In the next video, I'll talk about the important questions like what causes spina bifida, the risk factors, How can I prevent this? So I'll talk about a lot of this. It's going to be quite a long series. I urge you to stay on this channel, keep following, and subscribe. Knowledge saves lives, and early diagnosis changes lives.